Welcome. This is Dr. Aslam. Let us see Pharmacology MCQ number 1. The scenario is a 70-year-old man presents to a medical clinic reporting blood in his urine and lower abdominal pain. Here, the keywords include age 70-year-old, blood in his urine, and the lower abdominal pain. He is also concerned about urinary frequency and urgency. Additional symptoms are urinary frequency and urgency. He states that he recently completed a cycle of chemotherapy for non-Hodgkin lymphoma. If he states that he recently completed the cycle of chemotherapy, it means it may be due to side effect of certain drugs. The case scenario, the main stream is a 70-year-old man present to a medical clinic reporting blood in his urine and lower abdominal pain for the past few days. He is also concerned about urinary frequency and urgency. He states that he recently completed a cycle of chemotherapy for non-Hodgkin lymphoma. The question is, which chemotherapy agent has most likely caused his symptoms? Options are cytarabine, methotrexate, rituximab, cyclophosphamide, and prednisolone. All these drugs are used in the management and treatment of lymphoma, cancer. Now, question is, we need to identify the offending drug which is responsible for the symptoms. The answer is cyclophosphamide. Let us see the explanation how cyclophosphamide is responsible for the blood in urine and abdominal pain plus urinary frequency and urgency. Let us see. First, we will see what is the difference between Hodgkin lymphoma and non-Hodgkin lymphoma. In Hodgkin lymphoma, there is a presence of Reed-Steinberg cell, while in the non-Hodgkin lymphoma, there is absence of Reed-Steinberg cells. The first drug, cytarabine, clinical indicated in the treatment of cancers, including leukemias and lymphomas. Reported toxicity is cerebellar toxicity. It affects the brain. Second drug, methotrexate, also indicated for various types of cancers, including cancer, rheumatoid arthritis, psoriasis, and toxicity includes hepatotoxicity, affects the liver. Third drug, rituximab, is a monoclonal antibody and indicated for treatment of cancer, lymphomas, and rheumatoid arthritis. And toxicity is related to the infusion reaction because it's an monoclonal antibody. And cyclophosphamide is also indicated for treatment of various types of cancer, lymphomas, leukemias, rheumatoid arthritis, and nephrotic syndrome. But toxicity reported is hemorrhagic cystitis. So, what is hemorrhagic cystitis? The hemorrhagic cystitis is the toxicity of cyclophosphamide, the drug that are used in the treatment of cancer, and symptoms include hematuria, blood in urine, difficulty in urination, increased urine frequency, and the lower abdominal pain, the same symptoms we seen in our case. And this condition is called as hemorrhagic cystitis. How to prevent? We need to ask the patient to take more amount of water, to drink more amount of water, to be hydrated. Mesna is 2-mercaptoethane sulfonate, and it is generally used to prevent the hemorrhagic cystitis. Bladder irrigation and discontinue the offending drugs, means cyclophosphamide. These are the prevention strategies for hemorrhagic cystitis. Fourth drug, prednisolone, which is the corticosteroid. Clinical indications, it is used in many autoimmune diseases, allergic conditions, plus also used in management of the cancer, and toxicity include eye, cataracts. So the answer for this case is cyclophosphamide, and this drug is responsible for the hemorrhagic cystitis, and the symptoms include blood in urine, abdominal pain, urinary urgency, and frequency. I recorded one video trick to remember specific toxicities of the chemotherapies, and you can check out to remember the specific toxicity of each chemotherapy drug. Thank you.